Hello, my name is Stephanie, and I will be presenting my project based on multiple sclerosis for Valley College, Medical Terminology, Class Section 7065. In this presentation, I will be addressing what is the diagnosis, etiology, epidemiology, symptoms, treatment, and prognosis. What is multiple sclerosis? Multiple sclerosis is a chronic progressive autoimmune disease that affects the myelin sheet of the white matter of the central nervous system, which is made up of the brain and spinal cord. Within the CNS, the immune system attacks the myelin as well as the nerve fibers. Myelin is the protective coating around nerve fibers in the central nervous system. It acts as an insulator and increases the transmission velocity of the nerve fibers it surrounds. The myelin sheet is the primary target of immune attack in MS. When any part of the myelin sheet or nerve fiber is damaged or destroyed, nerve impulses traveling to and from the brain and spinal cord are distorted or interrupted, producing a wide variety of symptoms. For example, when a motor neuron is affected, you now have an impairment of sending an efferent message from your CNS to the motor neurons that cause contractions in muscles and secretions from glands and organs. Within the symptoms of MS, you can find visual disturbances, blurred vision, color distortions, loss of vision in one eye, nystagmus, optic neuritis, diplopia, loss of sensation, speech impediment, tremors, ataxia, also known as limb weaknesses, loss of coordination and balance, bladder and bowel dysfunction, mental changes, depression, muscle spasms, fatigue, numbness, and prickling pain. There are no symptoms, physical findings, or laboratory tests that can by themselves determine if a person has MS. Several strategies include a careful medical history, a neurologic exam, and various tests including magnetic resonance imaging, evoked potentials, and spinal fluid analysis. In order to make a diagnosis of MS, the physician must find evidence of damage in at least two separate areas of the central nervous system, which includes the brain, spinal cord, and optic nerves, evidence that the damage occurred at least 1 month apart, and rule out all other possible diagnoses. The cause of MS is still unknown. Some evidence supports immunologic, environmental, or genetic factors as possible causes of the disease. MS is more prevalent in colder climates in urban areas and among Caucasians. Evidence suggests that vitamin D plays an important role. People who are exposed to greater amounts of sunlight year-round tend to have higher levels of naturally produced vitamin D, which is thought to support the immune function and may help protect against immune-mediated diseases like MS. MS is not hereditary. However, the risk of developing MS is 15 times higher when the disease is present in the patient's immediate family. More than 500,000 Americans have MS. MS affects women more than men in a 2-to-1 ratio. Roughly 70% of patients experience onset of MS when they are between the ages of 20 and 40, while 20% of patients experience the onset of the disease when they are between the ages of 40 and 60. Most medical treatment is designed to slow disease progression and address the symptoms of the disease, such as urinary retention, spasticity, motor and speech deficits. Currently, physicians generally prescribe steroid therapy to reduce tissue edema during an acute exacerbation. Among steroid therapy are corticosteroids and immunosuppressive agents that help reduce symptoms and induce remission. There is no cure for MS. The longevity of an MS patient is good except for the symptoms that cause pain, discomfort, and inconvenience, even though most patients will never become severely disabled.